Cobenfy, the new FDA-approved medication for schizophrenia. I have not prescribed it yet. I'm Lindsay, a Psych NP. I am kind of walking through with one of my mentees how she can start one of her patients on Cobenfy. Cobenfy is interesting because it's a combination of two compounds, trospium and xanomeline. And with the xanomeline, it basically turns on muscarinic receptors in the brain, and that helps to modulate dopamine release and just kind of calm psychotic symptoms. And then the trospium has been being used for overactive bladder since like 2004, so it's supposed to help with the side effects. So that's good because there's like a lot of like nausea and GI issues and things like that. I'd love to hear if you guys are prescribing it, what you're seeing in clinical practice. It is metabolized through the liver, and this patient did have some elevated liver enzymes, so that was something that we had to look at. There was no clear cause for the liver enzymes, and they were just mildly elevated, so just going to kind of continue to monitor that. This patient was also on olanzapine, which I had heard before, like, oh, with the penes, they're so anticholinergic, like you have to be careful with Cobenfy. Thankfully, I was staffing with a schizophrenia expert who's been using a lot of Cobenfy, and she has not had any issues. If the olanzapine, it was like dosed 20 and below, she'd be more concerned if it was like 30, 40, she said. And then really we're trying to get this patient to, 100 milligrams of Cobenfy for about 2 weeks, tolerating it, before we are going to pull back on the olanzapine and decrease that by 5 milligrams every week or two, depending on how kind of the patient tolerates it. What else? It's dosed twice a day, so a lot of people take it like in the morning and at night. Providers will need to get liver enzymes and bilirubin prior to initiating it, and assess heart rate too, because it can elevate the heart rate a little bit. And then, yeah, she's having a lot of success with it, like in addition to antipsychotic injectables. This medication was studied monotherapy, so, we get out in clinical practice, and that's not the reality of our patients with schizophrenia. But yeah, Cobenfy has to be taken at least 1 hour before a meal and at least 2 hours after a meal. I'm teaching myself this sometimes, like saying this stuff out loud helps me like learn it, because I haven't used this medication in clinical practice. So yeah. So anyway, if that's